Hi, I'm Ann Peterson, and my business is Your Vibrant Health. My philosophy as a massage therapist and lifestyle coach is that we are all part of God's brilliant design. This means letting go of the notion that we can trick or force our bodies into behaving a desired way, like we have a better idea than God Himself. Rather, I believe in working with the body's infinite wisdom on how to heal. Give your body the building blocks of health and stop throwing roadblocks in the way, and it will create a masterpiece of health that will bless your experience of life and help you reach your full potential. Massage is one tool in that endeavor. The attitude that the massage therapist brings to the table is critical. Apart from the initial assessment where visual details can reveal the state of a person's health, I commit to connecting to the soul or essence of that person. Like a twisted tree on the weather-beaten coast, a person may have survived traumatic affronts to their body or psyche. They are vulnerable under the sheets, so it is an awesome responsibility and privilege to create trust between the client and me. Once there is trust, or even just a little bit, the walls can begin to crumble. It matters not what a person's political or religious views are, even if they may differ from my own. Discussions of that nature must stay outside as we enter the sacred place. That does not mean that I abandon my values, but it does mean that I do not require people to fit into ideological boxes. They should feel absolutely free to be themselves without judgment. In my experience as a nurse assistant at a nursing facility and as a former firefighter, I have responded to people in crisis. I have seen the full range. These experiences have deepened my understanding of the human experience and the preciousness of life. I bring that to the table. I do not believe in disease management. I believe in building health. If an individual has agreed to take personal responsibility for their lifestyle choices and to look with clear and open eyes at the outcomes of their choices, they will gain hope and a sense of freedom about their lives. As a healthcare practitioner, I seek to form partnerships in these exciting journeys. Active participation is required of the client. Although massage therapy may seem to encourage the client's passive participation, the active part for the client is the act of letting go, and by doing this, they are giving their body the opportunity to do what it knows needs doing, whether it be detoxing or healing at the cellular level in parasympathetic mode. There are so many types of massage therapy, each tackling a different application of touch or even no touch at all, as with some forms of energy work. Yesterday, I caught a snippet of a show on the History Channel. It was about a revered royal couple, the King and Queen of Spain, and this story took place centuries ago. The king had slipped into mental illness, exhibiting symptoms that would be now classified as bipolar disorder with psychosis. No doctors could help him. The queen, in her desperation to find him relief, remembered how much he loved opera music. She had a very gifted opera singer come in to sing for him. Somehow, this experience pulled him out of mental illness. Whether it was a way to commune with the intense emotions of another human being, or whether it was the vibrational energy of the notes hit by the singer, we may never know. My friend and fellow health practitioner John of Thriving Energies here in Prescott uses a variety of personally tailored vibrational tones to work in this way with dramatic success. Craniosacral therapy involves gentle, barely there touch. Our Our cerebral spinal fluid circulates through the core of our central nervous system. It is not clearly understood how it circulates because it is not influenced by the heart, like the circulatory system, or by movement, like the lymphatic system. One plausible theory is that it responds to electrical currents. In line with this theory, the therapist uses craniosacral techniques, placing their hands in precise positions to create a current loop that goes through the client. It is subtle but very effective. And one sign of success during treatment are little reflexive tics in the extremities. These are the process of unwinding. I have personally experienced a health breakthrough as a result of this craniosacral session. In my case, I believe it was the result of optimizing my pituitary gland's function. This gland is cradled in the only movable bone in the skull, the sphenoid. It seems like a minuscule rattle, shake, and roll kind of wake-up session. But of course, I can't prove anything. By contrast, in the spring 2019 issue of Massage Therapy Journal, in an article entitled Integrative Healthcare and Massage Therapy, studies were cited to indicate massage's role in alleviating the symptoms of many chronic diseases. Several studies suggest that massage therapy, in place of pharmaceutical interventions, can help alleviate pain and stiffening in osteoarthritis. Abdominal massage can alleviate constipation, a common symptom of Parkinson's disease, as can activating the vagus nerve via gag reflex or gargling exercises. Range of motion is another struggle for those with Parkinson's. Thai massage, with its stretching and comparative acrobatic moves, can assist in optimizing range of motion. To quote the article, of 181 outpatients with Parkinson's surveyed, 96.3% found rehabilitative therapy involving massage therapy most effective. In the case of fibromyalgia, a lighter touch is warranted. Sometimes simply using the warmth of your hand and concentrated intention, or using magnesium or CBD infused lotion, can help. I am genuinely excited about the range of possible health benefits that massage therapy presents within the context of a functional medicine approach. As I learn and grow, I hope to have an opportunity to serve you in your journey to optimize your health.
Oh, very good.